Good morning, everybody. Welcome to my Facebook Live. I'm Dr. Jyoti Patel. I practice internal medicine and pediatrics and integrative medicine in Fountain Hills, Arizona. So thank you for joining me this morning. If you're not watching me live or you catch my video later, please put your where you're from in the comments section. Hello and good morning, Karen. And also, if you know anyone else that can benefit from this talk, please don't hesitate to share or tag this talk. It's regarding the thyroid, which is a very important talk for so many people, especially women. Good morning, Jean. Okay, so what am I going to focus on? Because the thyroid gland is such a big topic. Good morning, Mark. Most of the people that are watching today are interested in low thyroid states. Okay, so we're going to focus on low thyroid states. But if you're watching and you have Graves' disease, which is high thyroid, or you've had thyroid cancer like me and have no thyroid, you still are going to benefit from this talk. So please stay tuned and ask questions along the way because I love questions. It helps the talk go along a lot faster. Okay, all right, so you have symptoms. You're gaining weight, you're cold all the time, you're constipated, your hair's falling out, you're losing your eyebrows, you're tired all the time, your muscles ache, you have some mild depression maybe, and you suspect that you might have a thyroid problem. So you go to your doctor and you tell them you want to get tested for the thyroid, and your doctor runs the tests and calls you later and says, everything turned out A-okay. And you say, well, how's that possible? Because I know I have thyroid symptoms. Well, here's the thing. Most people are underdiagnosed or incorrectly diagnosed with no thyroid problems when they still have a problem. So to teach you a little bit about the thyroid in the way that doctors look at the thyroid might help you and your next visit ask the right questions, get the right tests, and figure out whether you still need support for your thyroid, okay? All right, so I'm going to take you through a quick analogy. Back to the kingdom, if you heard my last talk. So the brain, imagine the brain as a king of a kingdom. And this king, called the brain, has 50 trillion subjects. These subjects are your cells, and every cell in your body requires a hormone called thyroid to allow it to function. So whether it is to regulate your temperature, whether it regulates your hair and your skin, whether it regulates your mood, your sleep, your weight, thyroid is essential and critical to every cell in your body. So the brain senses whether or not its subjects need thyroid hormone. And if there's a low level of thyroid in the kingdom, the king will send a signal. Now that signal is called the TSH. It's really important to know that because when you get your blood test done, you're going to be told your TSH is high or low. If your brain detects low levels of thyroid, the signal TSH is going to be high. If the brain thinks you have too much thyroid around, the TSH is going to be low. So people never remember that because it's always opposite to what you think. If you're low thyroid, your TSH is going to be elevated. So the brain is now sending a signal down to the thyroid farm. Okay, so the farm is where the thyroid is made. This is at the base of your neck. So this farm is where the farmers are creating thyroid hormone. Now, if everything works perfectly, there's thyroid release into the bloodstream and the cells are happy. But here's where the problem occurs. Okay, so first, the king's army, the immune system, gets a bad signal that something nefarious is going on in your thyroid gland. So your immune system starts coming up and attacks the thyroid gland. It starts to put the fields ablaze. It starts burning down your fields of thyroid gland. So it's causing inflammation. It's destroying the thyroid gland. Now this may be because of the bystander effect. There might be nefarious characters or toxins in your thyroid that the immune system is attacking, or the immune system has mistaken your thyroid for a virus. So you're starting to have an attack on your thyroid gland. The second thing that happens is people start dumping toxins in your farm, okay? So these are things like plastic and BPA from your food items. You might be drinking out of plastic bottles. You might be making things in plastic or heating things in plastic. You might be using nonstick cookware and you're getting those PFOs into your bloodstream, these toxins all kind of get attracted into the thyroid gland. You might be eating food that is laden with PCBs or organophosphates, which are pesticides that can affect the thyroid gland, can cause toxicity. So now people are dumping toxic waste in your farm. So your farmers are trying to field off the immune system, which is causing fires in your fields. It's trying to clear out some of the toxins that are starting to be dumped into your field. And third, your farmers need ingredients to make thyroid hormone. And you might be deficient in these hormones. So, these minerals. So you say to me, what does the farmer need to make thyroid hormone? It needs iodine. So you've heard this, but iodine is a really crucial element for the thyroid gland to make thyroid hormone. Normally we get iodine in seafood or sea vegetables. Most of us don't get enough of those, but here's the thing. Back in the 1920s and 1930s, the government put iodine in table salt. So in the standard American diet, there's so much iodine anyway, most of us are not deficient. So before you supplement with iodine, please make sure you check a level because most of us are not iodine deficient. Okay? So iodine is important for your farmers to make thyroid hormone. So you need to make sure you're getting the right nutrients. What else does it need? It needs iron. If you're iron deficient, let's say you've got heavy cycles or you're iron deficient, you're anemic, it doesn't matter what else you do, your thyroid's not going to be able to make the right amount of thyroid hormone. So make sure you check iron levels and get checked for iron deficiency. There are a couple other vitamins, vitamin C and B2, that are also important for the thyroid gland. So think about it. There's so many factors that are against you when you have this autoimmune thyroid problem. Now the farmers have finally made active T4. The 4 stands for 4 iodines, okay? Now that's not the end of the story, guys. That T4 has to get converted to T3, which is its active form. So the farmers send the crop to the factory to make bread. Guess what? The factory needs ingredients. So what's the number 1 trace mineral? If anyone knows, they can comment. What's the number 1 trace mineral that's required to convert free T4 to free T3? Selenium. So this trace mineral that you get in Brazil nuts and you get in cranberries and you get in strawberries is essential for you to convert your T4 to T3. So some of you might say, well, I just take a thyroid supplement because I don't even have a thyroid anymore. Well, remember, it's T4 if you're taking Synthroid. You still need to convert that T4 to T3, so you're not off the hook. You still need to pay attention to the nutritional needs that your body has, okay? So selenium is really important. What else is important? Zinc. Zinc is important to convert T4 to T3. You also need certain vitamins. You need vitamin A, and you need magnesium. So you've got selenium, zinc, vitamin A, and zinc. These are essential to convert T4 to T3. Okay, guys, so we're going to keep going. So this is not the end of the story yet. So now you've got active T3. That active T3 has to go inside the cells, okay? So in order for that T3 to actually make it inside the cells, because some people will say to me, well, my naturopath gives me T4 and T3, so, everything's really good. Well, not necessarily, guys. You still need to activate that T3 in the cell, the intercellular T3. Okay, so if you're iron deficient, that's going to be a problem. If you're vitamin D deficient, that's going to be a problem. If you're vitamin A deficient, that's going to be a problem. So most people don't realize how complex the body is. And I'm just always amazed at and fascinated how intricate our systems are and how many pieces it takes to get us to function the way we normally take for granted. Okay, so when you go to your doctor, what are you going to ask for? You're going to ask for them to check your TSH, which is the signal from the brain to the thyroid. That's number 1. You're going to ask them for free levels of T4, which is what the thyroid gland makes. You're going to ask for the activated T3 and the inactive reverse T3, because you want to know what's going on. Are you making good stuff or are you making bad stuff? Okay. You also want to check for autoantibodies, antibodies against TPO, antibodies against thyroglobulin. These are antibodies. The immune system is attacking your thyroid gland. You want to see how powerful that is. And if you are monitoring your antibodies, you'll be able to tell whether you're making improvements based on those levels. Okay. You also want to get a panel of minerals and vitamins. Now, I just went through why, But just as a reminder, you want to make sure you have the right amount of iodine before you supplement. You want to check your selenium levels, your zinc levels, your iron levels. You want to check something called glutathione. You may want to check some amino acids and vitamins. This is a panel that I do in my office often. It's a SpectraCell lab. And of course, that's going to help us maximize your thyroid treatment. Okay? So when you come in with this information, you're going to sound fairly smart. So take this information with you when you go to see your doctor. Okay? Okay. So you also want to check for celiac disease. 10% of people that have Hashimoto's thyroiditis also have celiac disease. Autoimmune diseases sometimes come in cereals, and people can have multiple things going on: ulcerative colitis or Crohn's disease. You may have malabsorption from other diseases in the GI tract. You might have medications that you take that block the absorption of these minerals. So these are some things that you can also have your doctor check. You can check for other hormones like cortisol, and you also can check your liver health, because that's also important when it comes to the thyroid. Okay, thank you, Karen, for your vote of confidence. Okay, so how do you take back control of your thyroid? I'm going to hit on 3 major ways. Okay, and I'm also going to talk about how to replenish your nutrients. So the first way is your immune system. We talked about that army, that king's army that's coming up and setting ablaze your thyroid farm. So you want to start with your gut. Now, in my previous videos, I talk a lot about gut health, so I don't want to beat that to death. If you have more questions about autoimmune diseases and gut health, my last week's video went into it in a lot more detail. Yes, Liz, you definitely want to get your iodine levels checked, especially before replacement, because again, there's a lot of people that take excessive amounts of iodine, and just because you've asked that, let me explain why. When iodide gets converted to iodine in your thyroid gland, it produces hydrogen peroxide. If you've ever had hydrogen peroxide, you know that it causes oxidative stress. And too much iodine causes oxidative stress in your thyroid, which can actually be harmful. So you don't want to overdo the iodine. You definitely want to check before you replace. So thank you, Liz, for that question. Joan says, are there any differences to my body between Synthroid and generic forms? I think I was once told Synthroid works better for some. Thanks, Joan. That's a really good question. So as I said earlier, I actually have had thyroid cancer and had my thyroid removed and have been on Synthroid for the last 16 years. I take, and this is my personal preference, branded medication only. And let me explain why. Thyroid is dosed in micrograms, so it is very, very small. It's very sensitive, and if you get any kind of bad product or changes in dose, your levels are going to be all over the place. And if you have thyroid problems, the last thing you need is to be laid up in bed or can't think or have brain fog or have levels that fluctuate all over the place. So in order to keep your levels the same, take the same brand every day at the same time. Take it on an empty stomach. Wait at least an hour before you take your other medications, especially things like calciums and minerals and multivitamins, but even food, to make sure that you're not interfering with the absorption of that thyroid medication. Okay? So the other question that's kind of parallel to that, Joan, is people will ask me, what about Armour? What about natural thyroid versus synthetic? See, here's the thing. Thyroid's thyroid. So, again, you can take a natural form because it makes you feel better that you're taking a pig thyroid, and that's a mix between T4 and T3. But if you have a well-functioning body, like I just explained, if you took just T4 because your thyroid's the problem, then the peripheral tissue will naturally convert T4 to T3. Okay? Now, if you have a problem with that, then you might need to take extra T3 like Cytomel or take a blend like Armour. Again, some people even have problems with taking up the thyroid in their cells, like we talked about if they have iron deficiencies or if they have vitamin D or vitamin A deficiency. So you might still not be optimized. So make sure no matter which one you take, whether it's synthetic or natural, you're making sure that your vitamins and minerals are in place. Liz is asking, do you know if there are any herbs that help get rid of thyroid cysts? So cysts typically are not a problem. We do ultrasounds of the thyroid often, and it's not uncommon that people will have thyroid cysts that are benign, that don't cause any harm to them. You might have nodules that are also benign, which cause no harm to you. Thyroid cancer is not very common. It's very rare. It's one of the more rare cancers. But if you have a nodule that is, getting larger, you definitely want to talk to your doctor about getting further evaluation. But in general, thyroid cysts, like if you've heard of breast cysts, or if you've heard of ovarian cysts, or if you've heard of kidney cysts, we have other organs that get cysts, which are fluid-filled sacs that really don't have any clinical bearing or any kind of problem. So I wouldn't go chasing after taking out cysts that are benign or worrying about them in general, okay? But if you are worried about thyroid cancer, then, again, that's a really important problem. We know that radiation exposure is one of the biggest risk factors for thyroid cancer. So if you live in a zone or in an area where you're exposed to radiation, or you work in a hospital or a setting where you're exposed to radiation, you may want to make sure that you're protecting your thyroid gland during those work hours. Good morning, Risa. She says, you're the only doctor who's ever explained all of this, including endocrinologists I've been to. I had to research it myself, traveling home, so we'll lose her soon. Oh, Risa, then catch me later, okay? Okay, and Liz says, I've read that the cysts are caused by low iodine levels. I have not seen that, but again, like I just said, if your iodine levels are indeed low, it puts a lot of stress on your thyroid gland, so it can't make the T4 that it needs. Because remember what I said? T4 is 4 iodine molecules attached to the thyroid hormone. When it becomes T3, it's 3 iodine molecules. So that 4 stands for 4 iodines, 3 stands for 3 iodines. If that helps, that's kind of what the science is there. Okay, so the gut, getting back to that. So some of the things that people say to me is, what should I not eat if I have Hashimoto's thyroiditis? There's a good amount of studies to show that gluten can be a factor in increasing inflammation of the thyroid gland. So if you're early in the process of having a thyroid condition, it might behoove you to try cutting out gluten for a period of time and checking your autoantibody levels and seeing if you stop the gluten, does that help decrease your autoantibody levels? If you're seeing an improvement, then you might be one of those people that are sensitive to gluten. Another question I often get is soy. I have thyroid disease. I was told not to eat soy. Is that true? There are certain foods that are called goitrogens, which might decrease your thyroid function. Soy may be one of them. But again, if you are going to consume soy, I recommend no processed soy. I recommend whole organic soy products like, edamame and organic tempeh or tofu. So in small amounts, I'm okay with it, and I myself take thyroid medication. Third, I hear a lot about cruciferous vegetables. People complain, they say, well, I can't eat broccoli, I can't eat kale or cabbage because I have a thyroid condition. You have to eat a ton of those vegetables for that to actually be a problem for your thyroid. And most people don't get enough vegetables. So I recommend go ahead and eat your broccoli, go ahead and have your kale and your cabbage. Likely it's not going to be a problem for you. If you're still super nervous, cook your cruciferous vegetables and eat them anyway, okay? All right. Rotate your food. Make sure you're getting a variety of things. Add in fermented food to help your gut heal better, okay? 75% vegetables, 20% protein, 5% good fats. Cut out the processed food. Oh, speaking of which, when I say gluten-free, often my patients will come in and go, Doc, I eat everything gluten-free. I eat gluten-free cookies, gluten-free cakes, gluten-free bread. So just on that vein, it's still considered processed. So even if you're eating gluten-free product, but it's off the shelf and it's in a box or it's in a container and it's been in a factory, it's processed. So I would rather you eat a whole food, plant-based diet. If you're gonna go gluten-free, eat quinoa, eat brown rice, eat your vegetables, stay away from the middle of the store where all the processed food is, even if the box says gluten-free, okay? Okay. Along with gut health, the last talks I've done are on infections of the gut. That can affect your thyroid. So again, you can go back and listen to the last talk from last week, how to detect and how to get rid of infections. There are certain medications. We talked about proton pump inhibitors like acid reducers like omeprazole and Protonix and Nexium. These medications suppress the acid in your stomach. So you know those very important minerals we just talked about, they don't get absorbed very well. So if you can wean off of those, talk to your doctor about getting off of those medications. Antibiotics ruin your gut microbiome. Excessive use of that is a problem. So talk to your doctor, tell them, hey, look, I'm not looking for an antibiotic. Are there any other remedies before I go to that? And only use it if necessary. Let's see. We talked about the gut. Okay, so next going on is supplements. So people always ask me, hey, Sherry, people always ask me what kinds of supplements should I take if I have Hashimoto's thyroiditis, okay? So first thing I always like is a good probiotic or fermented food, which is what I do, to help support the gut. Some people will take 200 micrograms of selenium. And again, you can check your levels first if you need it or not, but selenium is a good, safe bet. You can eat 2 Brazil nuts a day. We talked a little bit about selenium coming from spinach, coming from eggs, coming from Brazil nuts. This is a good source of trace mineral. So selenium might be something you want to take. Check before you supplement with your doctor, okay? So you've got iron, you've got zinc, you've got selenium, you've got iodine. These are things that you can check. If you need to take a good multi because your diet is not varied enough, you may want to check your vitamin A levels, D3 levels, check your B2, B6, and B12 levels. These are essential for thyroid function. So make sure you check it before you take it. But again, a good multi should take care of that. Another supplement that thyroid patients take is glutathione, known as NAC. And because of the oxidative stress and inflammation in the thyroid gland and problems with detoxifying in the liver, NAC can be something that patients need to detoxify. But again, before any supplementation, discuss this with your doctor, okay? All right, so we've got supplements, vitamins, checking your nutrients. Third thing that I want to talk about, actually the second thing, is stopping toxins. Liz has a question. She says, does baking soda with lemon and water help with the acidity in your body? I like that question, Liz. So when going back to the gut, the stomach acid is a really important factor in absorbing calcium, magnesium, minerals, and vitamins. If you overly suppress the acid in your stomach to the point that you have no acid for years, you're at increased risk for mineral loss, including osteoporosis and thyroid issues, okay? So how do you restore good acid in your stomach? My own remedy that I do myself every morning is lemon and apple cider vinegar with hot water. So this is sort of a more Ayurvedic or a natural treatment, but it increases that good gastric acid juices to get things flowing. Also, you can have another Ayurvedic trick is a piece of ginger, putting on some cayenne pepper, putting a little bit of rock salt and a little bit of sugar on there, and lime, and getting that into your system. And that actually wakes up the taste buds and it opens up the gastric juices and gets things going. So increasing acidity in the stomach can very well help with restoring that gut balance. Okay, I'll do another Facebook Live on stomach acid because this is the second time someone's asked me about it, and I think that would make for a topic on its own. Okay, so the second thing with the thyroid is toxins. There are a lot of toxins in our environment. I talked about it earlier. You've got plastics, you've got parabens from your makeup and your skincare products that pollute the thyroid gland. You've got organophosphates and pesticides that we eat on our foods that pollute our thyroid gland. So there are some simple things you can do. I would recommend you go to EWG.org. That is the Environmental Working Group. It's a nonprofit, independent organization that has a whole page on endocrine disruptors. So it's a page on all the toxins in your house, in your food, on your skin, and in your environment that might be polluting your thyroid gland. So check that out. It's a simple read. It's a one-page quick read. Okay, so EWG.org. Liz likes the idea about a topic on acid reflux. You got it, Liz. Okay. Okay, so we've got EWG. Now, the biggest organ to help you detoxify is your liver. Okay, every 6 minutes, your liver flushes your bloodstream your entire bloodstream and cleans and detoxifies. It's so important to keep your liver healthy because we just talked about how the toxins are poisoning your thyroid gland. Your liver is your friend to help clean up those toxins. If you have an unhealthy liver, if you drink excessively, if you have a fatty liver, if your diet has put your liver in stress mode, if you have a lot of medications that are putting a lot of stress on your liver is not able to get rid of these toxins. So clean up your liver. Make sure you're treating it nicely, eating healthy foods, fruits and vegetables, cutting out pesticides and substances that might be toxifying your liver. Be careful of over-supplementation. All those fillers and binders, they have to go through your liver, okay? So clean your liver if you want to get rid of toxins. There are some people that have a deficiency in their genes called MTHFR. That gene doesn't allow those people to clean medications out of their system as readily. So they are more prone to having side effects from a buildup of toxins in their system. They may want to take methylated products like methylfolate or methyl B12 to help them with their liver toxicity. Okay? So first is gut, second is toxins, third is stress. You knew I was going to talk about stress, right? So stress has a huge impact on the thyroid. When your brain is stressed, when it doesn't have the right nutrients, or it's chasing after other problems in the kingdom, it devotes less attention to the thyroid gland, which then causes the thyroid to fail. It redirects energy to other parts of the body, and the thyroid function starts to plummet. I see this a lot when my patients are discharged after a heart attack or a serious infection or some kind of a catastrophic medical problem. They come back to me from the hospital, and inevitably the hospitalist will check thyroid function, and of course it's down because the patient's resources are down and the brain is stressed. So rather than automatically just throwing people on thyroid replacement, I try to talk to patients about restoring their health, restoring their nutrition, getting their balance back so that their thyroid can function in a healthful way. So if you're one of those people that gets into the hospital and gets told that you have low thyroid function, give yourself 6 to 8 weeks of recovery before you allow anyone to put you on thyroid medication. Okay, so just be aware of stress being a factor. So the brain detects stress, and stress is obviously depressing your thyroid function. Reduce your stress level. Do relaxation exercises. Do breath work. Engage in meditation. Take up exercise as a regular thing in your life every single day. Tai Chi, yoga, walking, any of this stuff is going to help reduce your stress level and allow your thyroid to flourish. Okay? So again, you can do massage. Massage is a great way to detoxify. My favorite way is hot yoga. Hey, Paresh. And so I would recommend doing something like that to help sweat and release all the toxins from your system, but also to help you reduce your stress level. So try something new. Give yourself a challenge. Pick up a new activity that's going to help you reduce your stress levels. The last talk, I also talked about adaptogens. Adaptogens are herbs like ashwagandha, holy basil, ginseng, rhodiola. These herbs can also help downregulate your adrenal axis. So adrenal overload causes fatigue, salt cravings, low blood pressure, dizziness, causes mood changes, memory, brain fog. So if you experienced adrenal overload, check in with me, not next week because that's the 1-year anniversary for the garden and locals are all invited, 11 to 1. But the following week, I'm going to do one on adrenal fatigue. Okay, so that adrenal fatigue that causes those symptoms also can contribute to low thyroid states. So you want to try to rebalance that adrenal gland. Okay, so to end the exercises, to end the session today, I always like to end with a good mind-body exercise. So today I'm going to teach you a breath technique that's called the breath of fire. So people that have, hello Susan, people that have low thyroid are cold all the time and tired all the time. And breath of fire is a type of breath work that increases energy and increases heat. So if you're looking for a little bit of heat, you're looking for a little bit of energy, check this out. So you want to sit upright. Whenever you're doing breath work, you always want to make sure that you're aligned, okay? You want to pay attention to your navel, okay? So you can also start by just putting your hand on your belly button, okay? Push it in, kind of feel it there. Relax your belly, Okay, now you want to seal your lips, and I'm not going to be able to do it because I'm talking, but you seal your lips and you're breathing in and out through your nose rapidly, okay? And as you're doing that, you'll find that your belly pushes in and out. You always want to make sure that your breath in is the same length as the breath out. So you do that for 30 seconds to a minute to increase vitality, to increase energy, and to increase body heat. So breath of fire is your exercise for today. Well, that's it for me today, guys. Thanks for sticking with me for the whole half hour. I'm not going to be doing a Facebook Live next Saturday because it's the 1-year anniversary for our community garden in Fountain Hills. Everyone is invited who is local, 11 to 1. I'll rejoin you guys the following Saturday at 10 a.m. And my topic is adrenal fatigue. So if you know anyone who suffers from adrenal fatigue or is interested in adaptogens or anything to do with stress, that'll be my next topic. Okay, thank you everybody for joining me. Again, don't forget to put where you're calling in from and share and tag anyone that can benefit. Have a great day.